One of my passions as I was growing up was contraception. I was fortunate enough to work in India for several months, and I saw the impact of the lack of contraception. As I started doing more and more IVF, I just became very enamored by just the physiology, the geeky side of it, but then also just patients and their journeys and their experiences. Being the medical director entails making sure that specific protocols are being used, IVF cycles running the way they need to be done, and it's basically just trying to optimize treatments. We have some of the highest success rates in the region, and I think it's because we've been able to provide patients the most advanced and well-documented treatments. When we started the process of trying to have a family, each pregnancy that I had was being lost earlier and earlier and earlier, and then suddenly I was not able to get pregnant. In the end, I ended up having to undertake multiple in vitro fertilization cycles, or IVF cycles, none of which were successful. The way that we decided to start a family was to adopt, and so my daughter is adopted. Some people will say they're very sorry to hear my journey, and I tell them, look, I'm the happiest person to have undertaken that journey, because if I never did, I never would have had my daughter. The things that a patient will expect when they come here, they'll expect a supportive environment. Both Dr. Schulte and I are completely involved with their care. They'll have our supporting staff that actually help them every single step of the way. We're also able to provide some of the most advanced technology when it comes to fertility care. So they can come to expect that they're going to have highly successful care in a supportive environment, and that is completely science-based. Everybody's journey is completely unique, but I feel like I have a lot of insight into what they're going through, what those feelings are. I think that's why Dr. Schulte and I really feel very, very driven to provide the best fertility care in the region, is because we truly understand what people are going through, and we want to support them in their journey.